We've got an exciting day planned. We're going to be at the Manchester Muslim Heritage Centre. Type 2 diabetes is perfectly preventable, affects millions of people, but we know people of South Asian descent are 6 times more likely to develop type 2 diabetes. So my mom died of type 2 diabetes. She was 48. It's something that has a very important place in my mind from a health inequalities point of view, because the inequality there was mom developed diabetes at a time when we couldn't afford the treatment. It's not as though she had a condition that couldn't be managed. It was just the inequity of access to high quality treatment. And she slipped into a diabetic coma eventually, which again could have been reversed. It just needed insulin, a lot of hydration. It's not more complex than that. I do care about all the other long-term conditions, but because of my own particular personal history, diabetes holds an especially important place.
I think the system can provide some kind of education.
You've just said to me, everybody needs education. So what would you say to me, sitting in my role in the national team in the NHS?
If we can educate the Imam of those community, if you can educate the teachers, which are very important.
I'm just heartened to hear, this lovely gentleman here telling us that we are on the right path. Thank you for having us.
Yeah, pleased to meet you.
Good to meet you. Can I just say, magnificent building, and it's great to meet you all. And I was just hoping that you could share with us, what you've been doing.
After Jummah prayers on a Friday afternoon, we used to get, before COVID, around about nearly 800 people attending this on a Friday afternoon. So we laid the surgeries on for risk assessment with Diabetes UK. We brought about 45 Imams together. There's more than 45, but we started with about 45. Yes. And they now started talking about diabetes, health inequalities, stroke and other challenges that the Muslim community face. But not only talk about them, but then take them into the sermons on a Friday afternoon. In order for the project to be successful, Bola, we knew that women would respond better to women, religiously and culturally. We started off with that thought of saying, how do we engage with women, particularly Muslim women, who often get excluded from mainstream services?
As we're now going into some of the more deprived communities within the greater Manchester area, it's very much that focus on how do we go to the communities at the margins. I'm really looking forward to learning from them what has worked, what are the things that have enabled them as ordinary members of their own community to be able to carry a health message. We're here at the OBA Millennium Center to listen to some brilliant women and the work they've been doing in type 2 diabetes prevention project. Healthy food, brown rice, stir-fried samosa. So can you tell me what the type 2 diabetes prevention project involves?
The board decided to set up a project to train the trainers within the South Asian communities and Muslim communities to then go out into the community to train other people.
Within 4 weeks, up to 63 women we have engaged.
That doesn't happen overnight. You have to work hard in the community. You have to be that face in the community.
So all the elements of a lifestyle, it pulls them all together, and it's the factual. It's not just hearsay or something that that you get in communities. Oh, this will work for diabetes. This will work for diabetes. This is all research based.
Not only take responsibility to kind of your own health, but your family's health, your community's his health. And I think that is so powerful to change that culture, and that's what we're all trying to do.
What would you say has been the greatest impact that you're having?
We are empowering them, and then they will be able to handle their own health, and not only own health, but all the other related family members as well.
And the community.
Yeah. And the community as well, yeah.
And the seriousness of diabetes. Father-in-law passed away from type 2 diabetes. He had to have both his legs amputated. That's how serious it is. And now people don't know because they just think it's sugar. We just eat less sugar, we'll be fine.
Type 2 diabetes is a reversible condition, and that for me really, really hit home because my mum's had type 2 diabetes for a long time, and as a direct result of this, she actually changed her diet, and the last time she went to the GP, he said, even if you came off the medication, you would be okay.
I actually changed all my cooking habits, and I've used less oil and everything, and he's cleared from having diabetes.
Oh, well done,
he went
yeah.
for a blood test and he was clear, so this has helped me a lot.
Fantastic, honestly. It's such a pleasure to meet you, and thank you for all the work that you're doing. It's a pleasure to meet you, and great to meet the rest of your team as well. Thank you for having us. I think it's been extraordinary, the influence that you've been able to have over the community.
Imtiaz, manager of Jinnah Daycare Centre, which is a daycare centre for over 50s. You see, somebody will have a grandchild, and what they'll do, they'll bring a box of sweets, those Asian sweets, different colours. And I think they're not even 100% sugar, probably 200% sugar. And, they start eating it. And we have to say, no, you've got diabetes, you've got to control yourself.
If we continue to consume wheat and rice, I don't think the diabetes is going to be manageable. You can reduce the impact, but it needs to be a lot more than that. And I personally, within my own family, have done that through this project, and there are options available, and you'll see a significant impact on weight.
Because we know, for example, that having poor health causes stress, and stress is both has a physical manifestation in cortisone, but also it affects the mood and the psyche of the person, and therefore you cannot separate body and soul. And Islam concentrates a lot on looking after oneself, not only from a spiritual point of view, but also from a physical one.
When we knew that we were going to make a pack, a diabetes pack, to train members of the community and Imams, I suggested an idea of preparing a khutbah, a sermon, which any Imam, English-speaking Imam, can then use to deliver that on a Friday to educate Muslims, or the people from the Muslim faith, that this is from a part of our faith to look after yourself, to look after the body, the blessings that God has given us. So this is, listen to your GPs, listen to your doctors, listen to their advice, because it's not something alien. This is part of our faith.
We organised a chair-based exercise class, yoga class. I think some of the ladies even do Zumba. I'm locked away in my office on that, so I can hear the screams.
Sounds exciting.
It is.
I think reflecting on my own personal experience about the fact that my mum very sadly died at the age of 48 due to the complications of diabetes. Coming into Greater Manchester and spending the day with these wonderful people, one can't help being on one level emotional about what could have been, but also on another level feeling hugely encouraged that things have changed and are changing significantly. Keep on keeping on. It's magnificent work.
Thank you.
Thank you. Thank you.